urine analysis at 6 a.m. and 10 a.m. we have a separate specimen. So 81000, suppose they have used a microscopy, and 81000 with 91 modifier. So you can see 91 modifier has been added on the duplicate. Okay. And when we need to, when we cannot use 91 modifier, although they are repeating the test, first one, if it is not ordered by doctor. If pathologist said, "Arey ma'am, you give me two samples," I will do that. No. Doctor should order. Second, if it is because of a technician's fault, what I told you, you got a call from the pathologist. They said, we missed your sample. Can you please come again? No need to add 91 modifier on the second code. You cannot put second code. Third one, if they are using same sample. Arey bhai, same sample. Suppose I took your blood, okay, this much, and I divided into two test tube. One test tube I run in at 8 o'clock. The second test tube I run in at 9 o'clock. Same sample. Do you think there will be a different result? No. Same sample, no? So for same sample, you cannot code a multiple code. You got this point? First one, it should be ordered by doctor. Second, it should not be technician's fault. Third one, it should be separate sample. Then only you can consider for 91 modifier. Good? Take this question. Let me know if what will be your answer.
RMD है क्या तेरे पास? RMD है ना? RMD है ना? RMD लेका मत देख लेका RMD
ये क्या
है गुटका है लेका
What do you think? 25-year-old lady Mary visited a clinic for the pregnancy confirmation. On the same day, John has visited the same clinic for jaundice test. The physician has ordered 81025 and 811 for Mary and John respectively, but the technician has incorrectly labeled the specimen where the urine sample of Mary has been labeled to John. Now John is pregnant. Right. Hence, the technician has to repeat the test for both. How would you report the clinic? The clinic will report bill for John. So for John, it's a 81000 urine analysis.
Option D, sir.
Can we repeat this one? No.
Option D.
Do I need to code 810? Okay, fine. Do I need to code 81025? No, na? Just give me a minute. No. Correct. The answer will be D. We cannot multiply this one simply, so C option cancel. We cannot multiply with the 91 modifier. Why? Because it was technician's fault. So A cancel, C cancel. I cannot quote pregnancy code for John 81025. Cancel. So answer will be D. Good. Now, good question. Okay, very good thing. Very good. In this question, first thing, we cannot use 99 modifier.
I have to change the barcode.
$99 modifier we cannot use. 70 modifier, 76 you cannot use. 76 is for radiology. A option cancel. You cannot use 76. You cannot use 99. Okay. Then we A option cancel. Okay. I did not read question even. B option also cancel. Why? Yes, you cannot multiply the same without 91 modifier. Right? Now we have B and C. Tell me which is the correct. Which is correct way to code 91 modifier. Do I need to use 91 modifier with all the codes, or we can exclude, or we exclude with the original code?
Option B, sir.
Exclude with the original.
So option B.
Correct. See, 91 is for duplicate. You cannot use for original one. In a C option, A and D already eliminated. In a C option, you can see 91 is added with all three codes. Right now, if I am checking only one code, 83874, 91 into 3. Then where is the original one? They have added on all three codes. That is wrong. It should be, first code should be without modifier. Remaining duplicate codes should be with modifier. Good? B will be the correct answer. How we are going to code 91 modifier. See, by looking the option only you got scared. Right? How many codes and all. But we did not read question. Now you can read question. Okay, the patient present with the ED with the chest pain, shortness of breath, and a issue of congestive heart failure, but the physician perform 12 lead EKG will indicate a myocardial infarction without ST elevation. It means it's a heart attack. Okay. The physician immediately orders myoglobulin, quantitative troponin, and CK enzyme level to be run every hour for 3 consecutive hours. Means patient is coming with the full symptoms of a heart attack. Doctor suggested do this 3 tests in every 3 hours. So 3 hours we have to repeat this. Means every hour we have to repeat this 3 tests. The first time original one, no 91 modifier. Second and third time with 91 modifier. I will share you this slide now. You check this how we can use 91 modifier. Okay, please read the question and let me know what is answer. Which answer you can eliminate?
A.
A. Good. Very good. And D. Very good. A and D is eliminated. Now B, we have one option, and another option we have C. See, in B we can see 80550 is a single code, and then we have a 82552 and 82552 in 91 into 2. The exact how we can use 91 modifier, as per that B is also correct. C also correct with the same. So now we have to read questions. CPK enzyme level 82552 is a isoenzyme level. Now the only difference between B and C is whether they have performed both tests 3 times or they have performed only one test 1 time and another test 3 times. Now read question to find out this information. You got my question now? See, as per the now it's a smart work. It's not at all a hard work. I told you for CPC exam, 60% hard work is okay. 40% you have to be smart. Okay. This question, if you want to read question by end of the way, the CPK enzyme levels are elevated and all, you will forget what is the first line. See the A and D option eliminated. B and C, as per the B and C, I can see 82550 perform only once in a B option, and in a C option 82550 also perform 3 times. So now my approach should be, I need to find out only one thing. 82550 has been performed 1 time or 3 times. That I will check in my question. And what is 82550? It's a CPK enzyme. Now you got the answer.
Answer C.
C is the correct answer. Why? Because see, the patient present with the ED with the crushing chest pain radiating down to the left arm. Okay, remember this one line. Okay? By this one line, you can easily get to know it's a heart attack. I'm not talking about a CPC exam also. In a general line, if anyone is having chest pain, okay, left side radiating to the arm, it's a clear sign of a heart attack. Clear sign. Okay, you can save patient if you get to know it's a heart attack on time. Okay, so up under the chin. So from here it is going. There is an elevated ST segments on an EKG. The cardiologist see and admit the patient in CCU. He ordered 3 serial CPK enzymes level with instruction that the test also to be done with the isoenzyme. Okay. If the initial tests are elevated for the date of service and the CPK enzyme levels are elevated. So what doctor said? First order CPK enzyme. If the result is abnormal, order isoenzyme also 3 times. And CPK enzyme level was elevated. Okay. Sure. Now coming to the very important part, which is search pathology. 88300 code. Okay, surgical pathology is what? This. After operation, the sample of our body will be sent to the pathologist to check what is the abnormality. What was the abnormality? Already we have taken it. We have extracted. So pathologist will check that sample. He can check via two methods. One, gross examination. Gross means you can see the image. This is what? What is that image is for? Which image it is? Left side.
Kidney.
Kidney. Yes, it's a kidney. Gross examination means they will take the sample and check everything. Color, shape, size, any abnormality, everything except microscope. They will not use microscope on this. That is gross examination only. Then we have a gross and microscopy examination. Gross so they will do, that is mandatory. Along with that, they will do microscopy examination also. Okay. Now, for you can see for gross examination, we have only one code, 88300. For gross plus microscopy, we have 1, 2, 3, 4, 5 code. 88302, 304, 305, 307, and 309. Why we have 5 codes? You can see on that code we have a list of the samples. Right? We just have a list of the sample there. So, in a gross plus microscopy, that 5 codes are based on the levels, like how we play video game. We'll start with the basic Mario. I don't know about you. I started with the basic Mario, which is very simple. And then, as you will cross the level, the next level will be tough. Right? It is a concept of all video game. That is only when you will release it, that your dopamine will release. You will feel, I did something. If you cross one level, which is the highest, and second level is very, very easy, you will not play that game. Right? No? It should be very challenging every time. So similar way, 302 is a one basic gross plus microscope, which is very low. 304 is a low, 305 is a moderate, 307 is a high, and 309 is the highest one. Level, or I should say complexity, has increased in the level. Now, what is this level and complexity? The condition. Why they have taken the sample? If it is for normal disease, it will come to 304, 305. If it is cancer, which is the scariest thing, right? Biggest disease, severe disease, that is 309. Just have a look on the 309 list. Go to 88309. Check the samples there.
ಅದು ನಮ್ಮದು ಆನ್ಲೈನ್ ಪ್ರೋಸೆಸ್ ಕಂಪ್ಲೀಟ್ ಆಯಿತು. ಅದಕ್ಕೆ ಅದೊಂದು ಸೆಲೆಬ್ರೇಷನ್.
ನಿಮ್ಮ ಪ್ರೋಸೆಸ್ ಅಲ್ಲ, ವಿಮಾನದಲ್ಲಿ ಇದು ಕೊಟ್ಟಿದ್ರು ವಾಚು.
ಇವತ್ತು ಫಂಕ್ಷನ್ ಇದೆ ಪ್ಯಾಲೇಸ್ ಗ್ರೌಂಡಲ್ಲಿ.
ಹೋಗಿ ಮತ್ತೆ
ಯಾವ ನೋಡ್ಕೊಂಡು
ಕ್ಯಾಬ್ ಬುಕ್ ಮಾಡ್ಕೊಂಡು ಹೋಗಿ ಬ್ರೋ. ಅಲ್ಲ ರ್ಯಾಪಿಡ್
ಚೆಕ್ ಇನ್ 309 you will get all cancer code only.
ಬ್ರೋ ಗಟ್ಟಿ ಇದೆ ನೋಡು. ಯಾವುದು ಅಮೆರಿಕನ್ ಟೂರಿಸ್ಟ್?
You will get breast mastectomy. Mastectomy, breast means they remove breast. Lung, total or lobe or segment resection. They remove lung. Small intestine resection for tumor. They remove small intestine. Testis tumor. This all is cancer. So they remove complete organ from patient's body. Small intestine, our intestinal part, where the food absorbed completely.
ನಿಜವಾಗ್ಲೂ ಹೋಗ್ತಿದ್ದಲ್ಲ ಸ್ಯಾಟರ್ಡೆ ಆಫೀಸಿಗೆ ಹೋಗಿದ್ಯಾ?
Completion code.
ನಿಮ್ಮ ರೂಮ್ನಾಗ ಯಾರು?
Okay, Jaydeep asked.
ನಮ್ಮ ರೂಮಲ್ಲಿ ಮಾರುತಿ, ನಾನು.
He wanted to remove his apprentice in a CPC A. That is why he needed.
ಹೊಸ ಫ್ರೀನಾ?
ಫ್ರೀ.
ಎಷ್ಟಿದು?
Yeah, my ID also APC ID. So,
ಒಳಗಡೆ ನೋಡು ಬ್ರೋ, ಇದಕ್ಕೆ ಒಂದು 8,000
small intestine, where our food absorbs,
ಕ್ವಾಲಿಟಿ ಅದು ಹೊರಗಡೆ
that we are removing. Lung,
ನಿಮ್ದು ಲ್ಯಾಪಿಗೆ ಕನೆಕ್ಟ್
where we breathe.
ಮಾಡ್ಕೊಳಕ್ಕಲ್ವಾ?
Why someone remove our lung? Just to kill us or to protect us, right? If this is enemy, kill us. We will remove lung. If it is a Hollywood movie,
ಕೇಳುತ್ತಲ್ಲ
ಏನೋ ಬೇಕಾ ತಿನ್ನಕ್ಕೆ?
or what? If patient is suffering with a lung cancer, if I'll not remove his lung, he will anyhow die with the cancer. Better increase his 5 year more. I will remove his lung.
ಟಿಫನೇ ಮಾಡಿಲ್ಲ ನಾವು.
ಮಾಡು.
Right? So lung we have removed.
ಮಧ್ಯಾಹ್ನ
Like you can see, there is no
ಅಲ್ಲೇ ಊಟ ಮಾಡ್ಕೊಂಡು
highest level than this 309. We are removing lung, we are removing intestine, we are removing breast,
ಅಲ್ಲಪ್ಪ ಅಷ್ಟು ನಾನು ಮಾಡಿ ಟಿಫನ್ ಮಾಡೀನಿ.
we are removing testes, we are removing all the organs.
ದೋಸೆ.
That is 309.
ದೋಸೆ ಮಾಡಿಲ್ಲ.
Highest complexity level.
ದೋಸೆ ಮಾಡಿಲ್ಲ ಅಂತ ಬ್ರೋ.
Okay? But if you come to 88304, which is for low level,
ಓ ಈ ಸಿಸ್ಟಮ್ ತಗೊಂಡೋಗ್ಬೇಕಾ ನೀವು ಡೈಲಿ?
ಇಲ್ಲ ತಗೊಂಡು
skin, come to skin in 304.
ಚೇಂಜ್ ಮಾಡ್ಕೊಬೋದು ಇದನ್ನ ವೈರ್ನ
Skin, cyst, tags, debridement.
ಸಣ್ಣ ಪಿನ್ ಚಾರ್ಜರ್
We have taken a small amount of a skin as a
ಹಾಕಲ್ಲ.
sample. Is it life-threatening condition? If anyone have a skin cyst,
ನೀವು ಬೇಕಾದ್ರೆ ಲ್ಯಾಪ್ಟಾಪಿಗೆ ಯೂಸ್ ಮಾಡ್ಬೋದು.
is it it can kill a patient? No.
ಯಾರು ಮೂವಿ ನೋಡ್ಬೇಕು ಅಂದ್ರೆ
They have cyst. Cyst means there is little outgrowth in skin. They just wanted to check whether it's a cancer or not. So they just take a small sample. Not a big operation also. Within half an hour the operation will be done. Patient can go home on the same day. Very easy.
ಈ ತರ
So the easy part is in 304. Toughest part is 309. And how we are going to from 304 to 305, 7, 9, the complexity, the level is increasing.
ಬಿಸಿಲು ಜಾಸ್ತಿ ಇದೆ.
Okay? That is the only concept for this surgical pathology. If you understood the concept, very easy. One more thing. Suppose they remove lung for cancer, which is coming on 309. But they asked, only gross examination I have
ಯಾವ ಲೀಲಿ ಹಬ್ಬ
performed.
ಇದ್ನಲ್ಲ ಮೊದಲು ಆ ಬಳಿ ಮಗ ಐತ.
Only gross for lung. Will you put 309 here? 309 is for gross plus microscopy. If they have not performed microscopy, then any complexity code is a 88300.
ಗಾಂಜಾ ಹೊಡ್ಕೋತ ಸೊಳ್ಳೆ ಮಗ. ಗಾಂಜಾ ಹೊಡಿತಾನ ಸರ್.
Okay, for 300 we do not have any complexity. Any complexity, any level. But if it is a
ಎಲ್ಲ
gross only, then it will come to 88300. Good?
ಇದು ಇಲ್ಲೇ ಇಟ್ಕೊಂಡು ಮನೆಗೆ ಇದು ಕಳಿಸ್ಬಿಡ್ತೀನಿ
ಅದು ಮನೆಗೆ ಹಾಕ್ಬಿಟ್ಟು
ಚಿಕ್ಕ ನಡೀತಾ ಕ್ಯಾರಿ
Now, write few things, few medical terminology. This is very easy terminology. When we will go to surgery, you will remember that one. I know. Okay. As of now, you can write down hysterectomy. Few of you already know that terminology. Hysterectomy. That is there. It's a removal of uterus. Uterus, womb, our first home in a mother body. That is womb or uterus. So removal of uterus is known as a hysterectomy.
ತಗೊಂಡು ಹೋದ್ರು ನಾನು ಫ್ರೆಶರ್ ಆಗಿ ಹೋಗ್ಬೇಕಂತೆ ಮತ್ತೆ
Salpingo-oophorectomy.
ಏನಿಲ್ಲ ಸ್ಯಾಲ್ರಿ.
The word is given here. Salpingectomy and oophorectomy. When you will combine these two words, you will get salpingo-oophorectomy.
ಇದನ್ನು ನನಗೆ ಏನು ಮಾಡ್ಲಾ ಅಂತ ಗೊತ್ತಾಗ್ತಿಲ್ಲ.
What is that? Removal of fallopian tube and removal of ovary.
ಅಂದ್ರೆ ತಗೊಳ್ತೀನಿ 1 ವರ್ಷ ಎಕ್ಸ್ಪೀರಿಯನ್ಸ್ ನೋಡಿ ಬೇರೆ ಕಡೆ ಹೋದ್ರೂ.
Just a minute. Now I'll show you one image.
ನೋಡಿ ಹೆಂಗಾಗುತ್ತೆ ಹೆಂಗಾಗುತ್ತೆ ಬ್ರೋ.
ಬಟ್ಟೆ ನಿನ್ನೆ ತೊಳ್ದೇನೆ ಬ್ರೋ ನೈಟ್ ನಾನು
ಮಾಡಿದ್ರಿ
ಮಾರುತಿ ಕೊಟ್ಟಿದ್ದೀನಲ್ಲ.
See this. This is female genital organ. You can see we have a bilateral ovaries. Right ovary, left ovary. Removal of ovary, oophorectomy. Ectomy means removal. Oophorectomy is a ovary. Very cute word, na? Oophorectomy. Oophorectomy is a ovary removal. Fallopian tube. Here you can see a tube-like structure, which having a part isthmus, ampulla, infundibulum, fimbri. That is fallopian tube. The removal of fallopian tube is a salpingectomy. Ectomy means removal. Okay. Whenever if I want to remove any organ, I will add the organ name and then suffix as a ectomy. Larynx removal, laryngectomy. Trachea removal, tracheectomy. Kidney removal, nephrectomy. Liver removal, hepatectomy. So fallopian tube removal, salpingectomy.
ಅರ್ಧ ಪೀಸ್ ತಿಂತೀಯಾ?
ನೀನು
ನಾನು ಅರ್ಧ ತಿಂತೀನಿ.
Uterus, that cavity, that triangle cavity,
ಅಂತ ಹೇಳಿದೆ ಎಷ್ಟು ಕೊಡ್ತಾನ
ಕೊಡ್ತಾನಂತ?
that
ನಾನು
is
ಅವಾಗೆ ತಗೊಂಡು
uterus.
ಮೇಲ್ಗಡೆ ನೀವು
So uterus removal,
ಕೇಳಿ.
hysterectomy,
ಅಂತ ಹೇಳಿ.
hysterectomy.
ಹೌದಾ?
Okay. So these are the three words.
ನೀನು
Now I'm coming back to 808, that panels code, not panels, surgical pathology code. You tell me answer and how you find it. Okay.
ಲ್ಯಾಪ್ಟಾಪ್ ಅದು
ಅಡ್ಡಿಲ್ಲ. ಸ್ವಲ್ಪ ಗೌರ್ಮೆಂಟ್ ಲ್ಯಾಪ್ಟಾಪ್.
See the first question: hysterectomy with bilateral salpingo-oophorectomy for cancer. Check 88309 and 307 both, and then decide what is difference between these two code. Do we have removal of uterus in 307 also?
ಅಂತ ಕೇಳ್ತಿಲ್ಲ ನಿನಗೆ
ಏನಂತ?
ಸಂಜೆ ತಾಗ ಬರ್ತಾನೆ
ಏನಂದೆ?
Last word: uterus with or without tubes and ovaries. What is the difference between 307 and 309 for uterus? This is all alphabet.
So other than neoplasty,
ಅವನು ಊರಲ್ಲಿ ಎಂಜಾಯ್ ಮಾಡಿ ಬಂದಿಲ್ಲ ಊರಲ್ಲಿ ಎಂಜಾಯ್ ಮಾಡಿ ಬಂದ
ಏನು ಎಂಜಾಯ್ ಇಲ್ಲಪ್ಪ. ಮಳೆಯಲ್ಲಿ ಸಾಗಿ. ಅದು ಅಪ್ಪ ಅವನು ತುಂಬೋದು. ಅದೇ
ಮೂರು ದಿನ
ಏನು?
3 days ಇಲ್ಲಿ ಮಳೆ
ನಿನ್ನೆ ನಮ್ ಗದ್ದೆ ಕೊಯ್ಲ.
Here,
ಗದ್ದೆ ಕೊಯ್ಯಕ್ ನೀನು ಮಳೆ ಬಿಡ್ತಾ ಇಲ್ಲ.
what is the difference? One
neoplasty.
is a other than neoplasm, the second one is a with neoplasm. 309 is for neoplastic, 307 is other than neoplasm. Good. That is why my answer here will be 309. Good now? Now second question: bilateral salpingo-oophorectomy for cancer. Now tell me what they are removing here.
Fallopian tube and ovary.
Are they removing uterus? No. But check only for fallopian tube or ovary, not for uterus. What is the answer I have given? 307 and 309. Check in 309 we have fallopian tube. E, F. 307. E, F, tube.
Yes, sir. It's their ovary with or without tube.
Ovary with or without tube. Neoplastic. right? Ovaries with or without neoplastic. They're not talking about uterus there. So only ovaries for cancer is coming to 307, not 309. Because in 309 we do not have ovary part. Only ovary we don't have. Right? Third question. Hysterectomy with bilateral salpingo-oophorectomy for prolapse. 305 or 309? Take it 305.
Yes, sir. 305.
305. Hysterectomy, uterus with or without tubes and ovary for prolapse.
Sir, what is prolapse, sir?
Prolapse means losing elasticity. That is called prolapse. That is another medical condition. It should be very tightened, right? Uterus to hold baby. Correct, no? If it is not holding baby, then abortion. That time. Clear है? How we can, and the good thing is you will get option on this, no? You do not have to code. You just have to find a correct answer out of 4 options. So better check all 4 options and see where the exact word is matching. In the second question, they have not given uterus. That is the reason we are choosing 307. If they will give uterus also, it should be 309 then. First and second question, the only difference is, see, both are for cancer. The only difference is that in a second question, uterus is missing. Okay? Please be mindful for this. Okay. Check this 2 question. And tell me the answer.
For the first one, it is 307.
307, because you will get in a 307 Wed's liver biopsy. Come to liver biopsy, needle / Wed's. Biopsy taking a sample. Needle means they will insert a needle on the thorax cavity and take a small sample. You must wondering, by needle, how they will take liver sample? Why that is not normal needle which we get. That is very thick needle. Okay? And the Wed's is a V-shaped biopsy. What is the answer for second question then?
B, sir.
8830. Why? Wed's liver biopsy. Correct.
Examination, sir.
Only gross. Gross plus microscopy 307. Only gross 300. But you say, the first question they did not give microscopy. Boss, if they will not give, consider as a gross plus microscopy. For gross only they should mention gross. Okay?
Sir, for 88300, in that they have not mentioned the organ's name, right, sir?
That all. Anything which is documented in 305, 7, 9, 4, anything which is only gross is a 300.
Okay, sir.
Okay. Any sample only gross. Any sample means which is documented in 302, 304, 305, 7, 9, anything, anywhere. If it is only gross, 88,300. Good. Two more questions we have. How would you report epidermoid skin cyst? Three zero four.
304.
Okay, in 304 we have skin cyst, tag or debridement. Correct. First question 304. Everyone got it? It is arranged in alphabetic order. A, B, C, D, E, F, G. You will get skin. In that we have a cyst, tags or debridement. Second one, how to report skin ulcer or skin lesion?
It's 305, sir.
How 305? In 305 it is documented.
No, other than these things, no?
Correct. So we have a two code for skin. 1304, 1305. 304 said cyst, tags and debridement. For any three things, 304 is the answer. Other than these three things, 305. So skin ulcer, skin lesion will come under other than these three. Or else you can check 302, 303, which is not in a code also. Good? Okay, let me come on the first FTR, then we'll go to the other questions.
So
FTR says,
before one I didn't get sir, skin.
which one? This first question, second question.
Second sir.
Second question, because what happened? No, in 88304 we have a skin cyst, tags or debridement. So we are taking skin sample for these three reasons: either cyst or tag or debridement. These all are a surgical procedure from the integumentary chapter. Okay. Apart from these three, if we are taking skin sample for any other reason, apart from these three reasons, it will come under 305. That you can see 88305, which says skin other than cyst, tags, debridement or plastic repair. So this skin ulcer or skin lesion will be coming under other than tags or debridement. Good now?
Yes sir, yes sir.
Okay. Now let's see what we need to remember for this surgical pathology. First, check if you can if your option have 88311 or 88331 code. Can you check 88311 code, which is add-on code? For decalcification, right? So if your option, any option, if you have with code 88311, Then check in your question whether decalcification word is there or not in a question part. If yes, it's there, that must be your answer, 311. If it is not there, you can eliminate that answer. Now, what is decalcification? Decalcification.
Removing the salts from the bone.
Taking out calcium. So calcium is not organ, that is why we cannot say calciectomy, na? So it's a decalcification. D means removal, calcium. So if we are getting any sample, to test the sample, we need to remove calcium. So first we have to perform decalcification procedure, and then we can go to our panels. Okay. So check if any option have a decalcification procedure with options. Okay. 88331, I'll tell you what is a frozen section. After this, I will tell you. That is also very important. Frozen section. 1 blocks they will prepare. Okay. That we can check. Second, we can check whether our question is asking for gross plus microscopy or only gross. Only gross, no matter what is the level, 88300, single code. If it is a gross plus microscopy, then only I have to go with the levels part. Okay. Third one, identify the levels we can see. Fourth one, you can solve this question based on the ICD guideline also. Fourth one, we can report 26 modifier because here also we have who will prepare the sample. Sample the slide preparation, doctor will not do. Doctor will just examine. All the procedure was carried by technician. 26 modifier, medicine chapter I told you. If we have one code which is for 2 people, okay, and now I have to code only for 1 people, I have to add 26 modifier. Okay. Very easy example for 26 modifier if you're still having confusion. Okay. In childhood, if you have any siblings, okay, then you must be knowing this one. If you are a single child, then I can't say. Okay. If you have a sibling and if any guest came, they will give some money. Okay. They will give money to you or to your mom, especially. This is for these two kids. Now that 100 rupees, if my aunt came, she gave 100 rupees to my mother for me and my brother. It means I also have sharing on that, and my brother also. So we will divide based on 60-40. I am big one, na? I am elder, so I will take 60 rupees. 40 rupees my younger brother. Correct? So now we have divided based on the ratio. The complete payment is 100 rupees. My mother will divide. Take your 50, chalo go. Okay? In that I need 26 modifier. If I say, where is my money, mom? Give me. I have only one note. I will make a change and I will give you. And I want my money. My aunt give me. She told me that I'm giving money to my mother, to you. I know that one. So I'll ask my money. I have share on that. Correct? So on that one money, me and my brother have sharing. We need to split up. But suppose if my aunt is giving me 50 rupees, my brother 50 rupees separate. Do I still need to share with my brother? No, I will not do that one. Because I got my own money, he got his own money. No 26 money. Okay? So if we have one code which shares for 2 people, doctor, technician, and we have to code only for doctor, add 26 modifier. If we have to code only for technician, add TC modifier. Okay? So these are the codes. Surgical pathology is a code where 2 people have shared. So they are saying what you are going to code for professional people. Then you have to add 26. If they are asking, report technical and professional component both. No need to add 26 modifier. Just code a simple code. This is one question. Now, look at the question and option. It's very easy. Without looking at book, you can solve. See, I did not complete my question also. See, give answer. Why A? 88311. Decalcification procedure. Last line it says and decalcification. There is no other option which has the same code. 88311. Easy, right? Now I can see 307. What is that? Left breast mastectomy. So breast mastectomy, we have 307, 309 both. Can you check 307, 309 for breast mastectomy? What is the difference between 307 and 309 breast mastectomy?
Sir, in 307, they have mentioned partial or simple mastectomy breast.
Correct. So
Whereas
307, it says partial or simple. It means they are not removing complete breast. Chota sa part or very simple part. But in 309, it's a with regional lymph node. What is a lymph node? We have a lymphatic circulatory system in our body. Okay. That have small nodes in all the body parts. So now, if why I will remove lymph nodes also. Regional means local lymph node. When patient is coming with the breast cancer, surgeon will remove the breast, complete breast. Okay. On that, surgeon is suspecting that cancer cell has migrated to lymph nodes also. If I will not check lymph node, if I will not remove lymph node, that can go anywhere in the body. Because there is no protective force we have. So what I'll do, surgeon will remove the breast as well as the lymph node. So zero chance that patient may suffer with cancer again. That is regional lymph node removal. So if that is given, 309. Not given, 307. One more thing you need to write down on the top of your book. The golden rule for this. Number of specimen is equal to number of codes. Number of specimen is equal to number of codes. So here you can see 3 individual tissue specimen. But that also 307 into 3. It's just opposite to that presumptive study. Remember presumptive drug testing? I told you, although there will be multiple specimen, only one code. Right? 305, 306, 307, 80, 305, 306, 307. This is just opposite to that. Here, number of specimen is equal to number of codes. So you can see one decalcification code is only in a first option. Similar way, 3 specimen means 3 code. That is also in a first option only. Which options you can eliminate here? What is the golden rule? Number of specimen is equal to number of codes. Okay. How many specimens here and how many codes we can see?
4 specimens.
4 specimens. 3 from the vaginal wall and 1 from the cervix. So which codes you can eliminate? A and B. Very good. B of 2 option eliminated. Now we have C and D. Now smart work. 305 is a code for vaginal wall. How do I know? In a C option also 305 into 4 and in D option 305 into 3. It means 3 code is for vaginal wall biopsy. Now my intent is only to check cervix whether it is coming under 305 or 307. If cervix is 305, the B, C will be answer. If cervix is 307, D will be my answer. Yeah, what is the answer for? D. Cervix is on a okay. In 305 we don't have cervix.
It's there, sir.
Here also we have no. In both the parts we have a cervix. Now tell me which code you will use. 305 or 307? What is the difference? 305 cervix is what? Here. Conization. Okay? One is a biopsy, one is a conization. What is in our question? Correct? So what is the answer? Yes, it's a biopsy only, not conization. Conization is again cone-shaped biopsy. Okay, that word is not there. Again, don't worry now how I will remember. By 50,000 series, you will remember everything about the genitourinary part. This is C. Answer is C only. Good. Chalo, one. These are the format of a surgical pathology. So if you are getting this kind of a format, you have to add 26 modifier. Because this format can only be written by doctor. So they are asking only for doctor here. Okay? So you have to add 26 modifier in such case. So here you can see necrotic fascia, left groin and the leg. That is soft tissue lipoma or soft tissue tumor. That is 88304. Answer will be C. Along with that, you can see ICD codes also. L448, L089, L0292. So as of now, ICD you can just bypass. Here the sample is a left atrium. So it is little advanced question. Okay. If you are completed surgery, then it would be better. Because if I say left atrium, they are taking that. Now you don't know atrium also. It is a heart part or heart muscle. So it will come under myocardium biopsy. Myocardium. Myo means muscle, cardium is heart. So this is little surgical part. So better we will see this kind of question in a after surgery. Okay. Anyhow, I'll share this question. Yep. Yeah, Shakti.
No, nothing.
Okay. Okay, one last question, and then we are done with that, and then we'll do postmortem. We will perform postmortem. Okay. Hysterectomy is performed for the non-cancerous uterine fibroid. Incidental to the hysterectomy, the patient's appendix was also removed. The surgeon separated the specimen into 4 containers. The uterus, the first tissue removed, was placed in the specimen, contained labeled uterus. The right ovary and the right tube were placed on the second specimen containing right ovary / tube. The left ovary tube in a place in the left ovarian tube. The fourth one is the appendix. How many specimen? How many specimen? 4.
4.
See, specimen is not really not always equal to organ.
అంటే
Specimen means how many samples. So maybe only one organ, but we prepare 3 specimen, 3 equal. Okay. Mostly it will be one on one, but in such case, okay, because you will not don't consider here as a uterus 1, then ovary 2, and then 4, 3, and appendix 4. Don't consider like this. Here we have 4 separate specimens. So 4 code. So can I eliminate A option as well as C option as well as? Mill gaya answer then na. A, C and D eliminated. Then what is the pending? B. So 88307, 305 into 2 and 302. 307 is for uterus, non-cancerous. See here they said non-cancer. 305, 306. 305 twice, 2 times for ovary and tube. And here now we don't need any 91 modifier. Okay, for the golden rule, specimen is equal to number of code. So no need to add 91 modifier. Okay. And incidental appendix is the 302. So, come to 302. I'll tell you few specimen. Please highlight those names. Okay. In 302, highlight foreskin newborn. Foreskin newborn. Newborn means age is less than 28 days. Second one, skin plastic repair. Third one, testis castration. 304, come to 304, abortion induced. 305 we have abortion is spontaneous and missed. So abortion induced means when we are inducing abortion, when doctor is doing abortion, that is less complicated. Okay, compared to when abortion happens automatically, that is more complicated, right? And spontaneous or missed abortion is a 305 level is up. 304 is a artery atheromatous block. Foreskin other than newborn. I'm still in a 304. Gallbladder. Skin cyst tag debridement. Soft tissue debridement. Soft tissue lipoma. Now come to 305. You can write down there biopsy panel, biopsy set. This is mostly for biopsy. Abortion, spontaneous, induced, artery biopsy, bone marrow biopsy, breast reduction mammoplasty. So here reduction mammoplasty means we are reducing the size of a breast. Endocervical curettage or biopsy. Endocervical curettage or biopsy. Skin other than cyst or neoplasm debridement or plastic repair. Small intestine biopsy. Testis other than tumor biopsy, castration. Uterus with or without tubes and ovaries for prolapse. That is 305. 307. Breast mastectomy partial simple. cervix conization, liver biopsy, needle wets, lung wets biopsy, ovary with or without tube, neoplastic, testis biopsy, uterus with or without tubes and ovary other than neoplastic, prolapse. Last one, no? 309, the last set. Breast mastectomy with regional lymph nodes, lung total lobe or segment resection, small intestine resection for tumor, testis for tumor, and uterus with or without tubes and ovary neoplastic. Below there we have 88311 decalcification procedure. Done? Okay. Tell me if you have any doubt. Always remember the golden rule, which is number of specimen which around with is equal to number of codes. Then, any doubt on this? All good? Okay. Then next come to 88331 332 code, which I told you. I'll tell you about this one. 88331. 332 is add-on code, obviously, which can be coded, reported along with 331. This is consultation during surgery, first tissue block with frozen section. Consultation during surgery. It means the procedure will be performed when the surgery is still going on. Suppose today patient came for surgery. Okay, 10 to 2 is a 4-hour surgery. Doctor has taken out the sample at 11 o'clock and same time he sent into pathologist and he required report within 1 hour so that he can decide whether I need to remove complete organ or this much part is okay. Okay? That is called consultation during surgery. Frozen section. What is frozen section? What doctor will do? Doctor will take that sample, small sample, and make a block, a wax block. There will be dice like block, which will be filled with the melted wax, and then between that we will put the sample and again wax. So it means that sample will be surrounded with the complete wax, and it looks like a dice only. We will freeze it for time being, and then after that we will cut it out. We'll make a slide and observe. Okay, so there's something like called a frozen section. So that if we prepared one block 88331, if we prepared two block 88331 and 88332, if we prepare three block 88331 and 332 into 2, very good. Because 332 says each additional tissue block. Fine. If we prepare 5 blocks, 88331, 1 and 88332 into 4. Done. Easy. Similar way, we have 333 and 334. 333 is not, this two code is not frozen section. That is for cytological examination. Cytologic, cell exam. From the touch prep, squash prep. Prep means fluid. Okay. The general meaning is we are taking from the fluid, which contain cells. So which, if two side, 333 and 334. So it sounds very easy code, right? Same concept, parent code, add-on code, right? We have one only challenge here, or one only interesting concept here, that if we have same sample, one sample, for that we are preparing blocks and we are doing cytological exam also. We cannot code 331 and 333 together. Write down there. I think if it is a down or top of your book, write down top of or down to your book. Do not code 88331. Okay? Do not code or do not report 88331 along with 88333 for same specimen. That is the important one, for same specimen. It means for different specimen we can code. Which is actually given between below to 334, this note section, for intraoperative consultation on the same specimen requiring both frozen section and cytological examination. If we cannot report 331 and 333 together, then how to report? We can report 88331 and 88334. Now you can see 334 is the parent code, add-on code. The parent code is 333. That's true, but you can see 334 down. What it says? Use 334 along with 88331 and 333. means both are parent code. Fine. This is very important and very interesting thing. Okay, check this down. Check down here. During surgery, one tissue block and one cytological exam prepared in the pathological consultation. So they did not mention that is a two separate specimen. So we'll consider it as the same. So 331 and 334 as per our guideline. During surgery, two tissue block performed in a pathological consultation. Only two tissue block, 331 and 332. During surgery, one tissue block and two cytological exam performed. 331 and 334 into 2. Correct. What if they are giving you multiple specimen? So if you are getting question that, you will definitely get. They will not ask for same specimen because everyone knows 331 we cannot along with 333. So if they have given you multiple specimen, write like this. Specimen 1, 3 frozen section, 2 tissue block and 2 cytological examination. 331, 332 into 332 and 334 into 2. Specimen 2, this thing. Specimen 3, that thing. And then combine everything. For different specimen, you can code 331 and 333. If you code these 3 specimen together, suppose this is a part of only one question. In one question, they are asking you 3 specimen. So the ultimate answer, what it will be? 331 into 2, 332 into 3, 333 and 334 into 5. Correct? That would be your total answer, the combined answer. So the better or the best technique is code separate. And then at the end you can combine. If you are coding separate, that would be easy. For one specimen, you cannot code 331 along with 333. First specimen you can see. Second specimen also you can see. We are not coding 333. But in third specimen, we have only cytological examination. Right? Good? Any doubt? If you want to write down, please write down, okay? That for different specimen, code separate. You don't always believe that you will remember those things. You know? I remember because I am teaching. I remember, if I recall my period when I was going to with the CPC training, that is only 20 days training. 20 days every day, 2 hours, they are done, finished. These are the go and write exam. They did not even, my trainer did not even take a seat. I think only 2 hours they have finished the pathology chapter. Done. Because that was an in-house training. My company people get. I cleared CPC because with the discussion. In a classroom, I did not learn anything. Frankly speaking, it's only 30% or 20% I learn in a classroom. Remaining 80% I learn with the discussion with my group. I had 6 people, my 6 friends. Every day before exam, it was like a 20 days back of the exam. And my training also we stopped in July, and I wrote exam on the October because they did not give a slot. That time it was not like every day it will be exam. It was yearly once exam. The CPC exam was conducted only yearly once or yearly twice maximum. So I completed my training on the July, and we were waiting for exam. They said, okay, your exam will be on October. August, September, October, 3 months. 25th October, I wrote exam. And then they said, no refresher training. So what we did, we asked, we requested our MD for refresher training. He said, okay, for 1 week, 1 hour class, that to morning 7 to 8. So I had to woke up at 5:30, get ready, catch my train to reach my office. Okay, in Mumbai local train. Reaching office by 7 to 8 class, 8 to 8:30 break, 8:30 to 5:30 work, 5:30 to 6 again rest. From 6 to 8:30, we were in office. All my 6 people, 5 people, 6 people, 4 girls, 2 boys. Okay, we discuss each and every topic. If I am good with the integumentary, I told them all the integumentary concepts. They remember, no, I think this is the correct one. Then by that 10-20 days only we learn all the things. Okay. So don't believe that you will remember everything. Make a note. That is better. I was reaching home 11 o'clock. Sleeping at 12, again waking up at 5. That was for 10 days schedule for me. That was very, the exam will be conducted only yearly once or yearly twice. I remember my friend, few of my friends, not from my batch, other people failed exam. We had to attempt. So for second attempt, they had to wait again 6 months. So they did not wait. They booked exam in Pune. From Mumbai, they have traveled to Pune. It's only 3 hours, 3 to 4 hour journey. Now the 2 hours only. But that time it was a 4 hour journey. So they travel there, they stay overnight there just to give exam. Because we don't have a second slot in Mumbai. And that too, it was October, already ICT 10 was there in 2014. Okay, and we are the last people who gave exam on the ICT 9. Because ICT 10 was a new thing for us that time. We knew that if we will give exam on ICT 10, we never got on that, we will fail. That is why we request our MD, please, to conduct exam at least for ICT 9. Okay. Then we got to know 10 is also easy. Clear this one? Okay. Just in it all. Yes. Then off. Okay. Feeling cold? Fine. Now come to postmortem code. Okay. Autopsy. For that also we have a code. Now only a small portion is pending. Small means tomorrow we will finish. And tomorrow we'll discuss medicine to a question also. 8800 to 88045. Make a set of 88000 to 88016. Got it, everyone? Got it? 88000 to 88016. Make a set. You can write down gross only. Only gross. Now you know what is the meaning of gross, right? Only taking sample. If I see how is this my phone looks like, it's a green in color, 2 cameras, the screen is good, everything. This is gross examination. Okay. When you do microscopy, we'll make it cut under microscopy how it looks like. Okay. So 88000 to 88016 is a necropsy or autopsy only gross examination. From 88020 to 88037, it's a gross plus microscopy. Eight eight zero two zero to 88037, 20 to 37. Gross plus microscopy. Okay, fine. Chalo. Now one by one. 88000 and 88020. This code will be same. The only difference is gross only and gross plus microscopy both. This is without CNS. CNS stands for central nervous system. We have two types of nervous system. Central nervous system, peripheral nervous system. Central nervous system is the center of our body. It means our head and skull. Head and spine. Without CNS means without brain and spine. Means the doctor is doing postmortem and checking everything except brain and spine. Okay? 88055, 88005 and 88025 with brain. It means CNS included, but not complete CNS without spine. But in next code 007 and 027, it's a brain with spinal cord. They are checking brain as well as spine. You all know now what is postmortem? Okay. When we were in college now, 2006-07, one postmortem video circulating in our group. So we got postmortem video. Come, we will see. After that only we cannot sleep on the night. And then it was shown everything, how they cut the body and all. And then we go, okay, that is normal then. Okay. 007, 027, brain and spinal cord. 012 and 028, infant with brain. Now, infant is a age group less than 5 years. Baby, postmortem with brain, but the baby age should be less than 5 years. 014 and 029, that is stillborn or a newborn with brain. Now, stillborn is a baby born before birth only, baby died. Okay, baby is dead in a mother's womb. That is stillborn. Born as a dead body. Okay, so like we have seen some memory that now the lady, the baby is born before birth, right? That is stillborn. Newborn within 28 days. 0 to 28 days is known as a newborn. Or neonates, ATES, neonates, newborn baby or neonates. It's the age limit is 0 to 28 days. If it is 29 days or 30 days, it will come to infant now. Okay. 88016 is a stillborn, is a macerated stillborn. It's only gross examination. Macerated stillborn means the baby's structure is not fully developed. Is stillborn, but the structure is not developed. We cannot see complete face, complete bodies and all. Macerated. Okay. This is when the baby born or the fetus died in an early stage of a pregnancy, especially on the 6th month or 7th month. Especially on the, before 7th month. Then 88036 is a limited gross or microscopic examination for the regional. Means we are not doing anything about the CNS, brain, spinal cord, anything. We are only taking a reason. Suppose abdominal reason. I am just checking abdominal reason organ. Stomach, liver, pancreas. This thing only I am checking. That's all. Regional, okay? Upper body region, lower body region, abdominal region, chest region. Groups of organ, but in a one locality. And the 37 is a single organ. I am not checking the entire body. I want to check only one organ. That's it. Fine. That is 37. 88040 is for forensic examination. Highlight forensic examination. 8045 is for coroner's call. Coroner's call is a cause of a death. They're specifically checking only to find out what is the cause of a death. That's all. Don't go with the 099 unlisted one. You can ignore for your CPC exam. So this is post-mortem code. Okay. This is only done by physician. Perform a gross post-mortem examination on a children. Exam include the infant brain but did not include the infant spinal cord. Only gross. First set. Infant brain. One. Right? Oh. So we are pending with derivative pathology and cytopathology. These two things. Molecular chemistry, this is very easy, will take little time. And cytology. ETT, I will tell you tomorrow. Okay, there, this is very important one. Glucose tolerance test. That will be done in a pregnancy. Remaining all these, you can easily see how easy it is, a direct code. We'll go with some codes. Next thing, 80550 CK CPK total, the 552 CK CPK isoenzyme, 553 CK CPK MB fraction, 554 CK CPK isoenzyme, CK CPK, cytokinin, and CPK what is it? Phosphatase kinase. Okay, these are some enzymes. That would be direct code, but still we will go with that. Okay. So tomorrow we are going to finish this chapter as well as complete. We'll go with the medicine discussion, question paper discussion. Okay. Any doubt in today's class, guys? Any doubt? All good? Good. Okay, please revise it. Okay, it's a very easy topic, but still few things are very, very important. Like what we have seen in surgical pathology, very important. The that one blocks. Okay, the block frozen section block, very important. You remember? Code. Surgical pathology, number of specimen is equal to number of codes. Okay. So whatever you are writing, make sure that you are writing first of all. And if you are writing, definitely it is printed on your brain. You just have to revise it. And I'll bet you when you are highlighting something and you are writing, when you will do revision, you will turning the pages. Those things you will remember. If you are reading for next 2 time again, today you will reading one time when you will take the test paper, that time you will revise. The third time when you are revising, when you will revise, when you are doing mock. If you are doing this 3 times very genuinely, you will remember all the concepts. I can bet you for that. Okay? Chalo. So then see you tomorrow. Tomorrow your class will be on the same 10 o'clock. Okay? I'll post on a group. Okay guys, then see you. Bye-bye. Surgery class will start now.